I'm Dr. Anthony Paravati. I am a cancer center physician executive, and I am co-host of the Value Health Voices podcast, alongside my co-host, Amar Roari. He and I leverage our combined more than 25 years in healthcare to break down complex health policy and healthcare finance issues for leaders, as well as aspiring leaders like you. Our job is to explain in simple terms how the U.S. healthcare system works or how it doesn't work. And Amar and I have been mining our networks in Washington to take stock of the government shutdown. This is a government shutdown that is about healthcare. And in this video, I'm going to show you what the government shutdown is all about. And I'm going to talk about the ACA subsidy expiration, what both of those things mean for your organization in 2026. You probably already have understood that the shutdown and the ACA enhanced tax credits or subsidies are deeply connected. Through our podcast, Amar and I have access to the nation's top health policy experts, and that's helpful. But another thing that's helpful and more important is that he and I in our work as oncologists see the real-world impact on patients of these health policy decisions every single day. And so in the next 10 minutes, from those two combined sources of experience, I'm going to give you 3 specific operational insights you can take to your organization and to your leadership team this week to prepare for what's coming. So as I intimated a moment ago, Congress shut down the government on October 1st, essentially over one issue, a healthcare issue. That issue is enhanced ACA premium tax credits and their expiration, or hopefully, if you're on the Democratic side anyway, speaking about Congress, and hopefully if you need to purchase a plan on the ACA exchanges, that these tax credits are maintained. And Democrats won't vote on funding the government without subsidy extension. And Republicans, they want separate negotiation. They don't want to talk about opening the government and tie the ACA premium tax credit extension to that at all. So that's the impasse we're in right now. The problem is that open enrollment for these plans starts on November 1st. That's nary a week away at this point. 24 million Americans are already shopping for plans, for 2026 plans right now. And 96% currently in 2025 receive subsidies. And the nut of the whole issue is those subsidies are about to disappear. Well, you've probably seen my co-host Amar Roari in the media all the time. He gets approached, I get approached, although less, for quotes for various pieces. And I was approached by somebody who said, give me something on the shutdown. We have a piece coming out. I said, listen, just go to KFF. So now that the shutdown's dragging on, everybody wants to talk about it. Even I was approached for a quote, an upcoming piece about the shutdown, and I'd simply directed them to KFF, formerly known as Kaiser Family Foundation. So in addition to tuning in to our podcast where we cover this and are going to cover it in an upcoming episode in depth, KFF are the best nonpartisan source on these kinds of health policy insights and analysis. And anyway, that's enough of an intro. Let's get to the hard facts and the data about what is going on or what's at stake with this shutdown. So I mentioned our friends at KFF. Their analysis shows that premiums themselves are expected to rise 18% on average. But if you combine the premium rise with the subsidy loss or the ACA enhanced tax credit loss, out-of-pocket costs are going to jump by 114%. That's more than double. Here's what it is in real dollars. Average consumer in 2025 paying $888. This in 2026 is slated to go to $1,904 on average. There's a lot of specific scenarios on specific member or patient or enrollee profiles out there, but I really do think that the KFF examples that they've put out are really good. So I'm going to quote them here. Let's talk about a middle income family. Let's say they live in California and they earn $82,000 a year. So currently their premium would be about $5,000, which is already no small figure. For them, the premium is going to jump, again, almost double, a little bit less in their case, to $9,000. An older, near Medicare age couple, 60 years of age, in Louisiana, making $85,000. Right now, they're paying $7,200 on an annual basis, and for them, it's going to jump all the way to $25,000. And it's because they, at that income level, will lose all subsidies. They are 4 times the federal poverty level, and so subsidies gone. Let's go to a final example of a young, healthy worker making $35,000 a year in Kansas. That individual right now is paying about $1,000 a year. Well, for him, it's going to go to $2,600 annually next year. this young worker, like many young people facing this kind of a scenario, this is exactly who's going to drop coverage. And dropping coverage for individuals like this, of this profile, is a feature of a system that starts to break down. So I just went through 3 scenarios in 3 different geographies. But let's talk about a single state that has a particularly impressive number of people who will likely lose coverage. And that state is Georgia, a red state. There, 340,000 people out of currently 1.5 million enrolled are likely to lose coverage, drop coverage in this scenario that I just explained. And these are numbers, but they are patients. They are members in my community, your community, our facilities. And so there's going to be an impact to them not seeking care, delaying care, foregoing coverage. My advice to you is take these examples down or go to KFF and find examples for your specific geography and take these numbers to your board meetings, to your leadership meetings, have them ready when senior leaders ask you why patient volumes are dropping and dropping in big numbers in Q1 in 2026 and beyond. And I'm going to give you 3 specific insights you can take to your organizations. Number 1, expect enrollment drops and patient volume changes. So the CBO itself estimates 4 million fewer people are going to have marketplace coverage if the subsidies expire. And so an obvious action is model scenarios with your finance leaders about what it looks like at 5, 10, 15, even 25% uninsured rate in your facilities, and what that does to your payer mix and consequently your operating margins. Insight number 2, bad debt and charity care as a consequence are going to spike. As somebody who works on the provider side of healthcare, real hospital, health system, this is something we see all the time. Patients delaying care because they anticipate an impact to their finances if they pursue it. They say, no, I'm okay. I'm going to forgo this, forgo that. And then their problems become much more advanced. And so for this insight number 2, what I would do sooner than later, maybe even this week, is get your team together and review your charity care policies and financial assistance thresholds now, and do that before January 1. And insight number 3 has to do with the moving targets of insurer rates. A key insight from our analysis at Value Health Voices podcast is that even if Congress extends subsidies after enrollment starts, plans may adjust their rates, but only if it happens before December 31st. Because after that, once the plans and patients are enrolled, members are enrolled in those plans, rate changes become very complicated. So for this, my recommendation is don't make major staffing or program decisions until a little later, perhaps mid-December, when there's greater clarity on the environment. And again, these insights, they're one thing, but in real life, we are seeing patients already ask us, should I start treatment now or should I wait? So not hypothetical policy debates. It's happening in our facility. I'm sure it's happening in yours. I want to close with something that a lot of the coverage has been missing. The coverage on the shutdown has rightly been focused on these ACA enhanced tax credits and their possible expiration. If you take that issue and the financial implications that I've outlined to some extent in this video, together with the Medicaid cuts that are now in place from the One Big Beautiful Bill Act passed earlier this year, it is a double whammy. It is a double whammy for certain types of hospitals and provider groups in certain states that amounts to, frankly, an existential crisis. And as it relates to this, I would encourage you to go back and listen to the 2 episodes we made with the famous Dr. Eric Bricker early this year on the Value Health Voices podcast, where we dug deep into the weeds about the specific implications of Medicaid programming in different parts of the country and the states that are going to be most hurt by the consequences of the One Big Beautiful Bill Act as the next couple of years play out. All right, let's finish with a CTA. If you're a healthcare leader or aspiring to be one, you need to stay ahead of policy changes that impact your organization. And so here's what you need to do. Follow me here for weekly breakdowns of the real-world impact of health policy and healthcare finance developments. 2, subscribe to the Value Health Voices podcast. Every episode gives you the insider analysis that makes you a more strategic leader. And finally, share this video, share these numbers with your CFO, with your board, with your teams. They need to know these numbers. And at Value Health Voices, we're staying on top of this, including hopefully in a full-length episode with a colleague from KFF here coming up in the near future. And you'll get the insights before they hit the news cycle, as well as a lot of stuff that misses the news cycle altogether. We put out content with analysis and education that makes you a more informed leader, more effective, and more strategic. That's our commitment to you. We're all navigating this together. We'll see you next time.